The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about arthritis. Over 25% of Montanans have arthritis, and it's the number one cause of disability in the nation. And actually, about 58 million people have arthritis. And we'll be talking with a program specialist with the Department of Public Health and Human Services as to how we have programs that can help these individuals, so stay tuned.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
My goal is to keep my patients safe, and my goal from the beginning has always been to keep my patients safe. Most of the time, these are elderly people. Taking care of these people, it terrifies me, and I'm scared for patients who are not vaccinated. I'm petrified for these folks because we just see how quickly they can go down in flames. But the way out of the pandemic is the vaccine, and we have it. It's at our grasp. We can end this. Game over if we get enough people vaccinated.
Hi folks, and welcome to Aging Horizons. I'm your host, Brian Lamore, and the show is brought to you by the Department of Public Health and Human Services. In my opening, I mentioned that we'll be talking about arthritis, and an amazing number of Montanans have arthritis, over 25%. So the Department of Public Health and Human Services has a program to address arthritis, and we have a program specialist with us today, Melissa Dale. Welcome to the show. It's great to have you here.
Thank you. Thanks for having me here.
Great. Well, let's start at the top. A lot of people hear the term arthritis, but I don't know if everybody really knows how a professional would define it. What is arthritis?
Well, it's a great question. So, when you're thinking about arthritis, the actual word arthritis means, when you break it down, arth means joint and itis means joint or inflammation. So when you put the word together, it's joint inflammation. So people who have arthritis would say yes.
Okay.
For sure.
So what are some of the indicators of arthritis, and maybe what kind of age groups are affected?
Yeah, so the number one, or the most common symptoms of arthritis is pain, joint stiffness, swelling, and inflammation, mainly within the joints there. So, and one interesting fact is that there's actually over 100 different types of arthritises out there. I know when people talk about arthritis, they just kind of assume it's just a one singular disease.
Yes.
But yeah, so it's actually, there's over 100 different types. The number one arthritis that we typically see is the osteoarthritis. And this is what we call the wear and tear arthritis. So within our joints, we have cartilage, which is a nice cushion between your joints, and over time, through joint injuries or, repetitive motion, that cartilage starts to wear away, and then eventually it's bone on bone. So that's where we call it wear and tear. But then there's other types of arthritis. Another common arthritis is what we call rheumatoid arthritis. And this one's actually an autoimmune disorder. And so it's your body that's actually attacking your cells. So it's attacking your joints. And so you can see that even though I just talked about two different arthritises, you can see how different they are as how you can get it. But the main thing, like you asked, was, it's from either, most people have the common symptoms of joint inflammation, stiffness, and pain and stuff there.
Well, a lot of us old guys at coffee, we get together and talk, and I got arthritis in my thumb from playing football or playing basketball.
Exactly, yes.
But now, if there's 100 types of arthritis, how does one adequately define it? I know I have arthritis. I went to my GP and he ignored it twice, I'll say. But you need to go to probably someone who really knows the 100 different types to get adequate medical care, right?
Yeah, so, the first thing you want to do is just to go, like you said, to your general practitioner or any healthcare provider. From there, they can help determine, and you probably would go to a rheumatologist. I apologize, a rheumatologist there.
It's a tough word.
And they can help you with your arthritis. They can help determine what type of arthritis you have, and then from there, you can work on your management and how to manage your arthritis.
Right, to take the correct steps for the correct issue.
Yeah.
And so how prevalent is this in Montana, arthritis?
So in Montana, like you said earlier, over 25% of adults have arthritis. So that's 1 in 4 adults in Montana. So like you said, most people, you probably know somebody here in Montana who already have arthritis.
Yeah.
And yeah, go ahead. Sorry.
Yeah, or you can go shopping and you can see people. I'm noticing a lot of people with limps.
Yes, exactly.
Well, now, is there an age group that this targets? I think the generalized people think that, it's our grandparents that have it.
Yeah, that's a great question. So one thing about arthritis, it does not discriminate on age or gender, whoever you are. Anybody can have arthritis, including children.
Oh.
And so that's one thing we don't really think about and surprisingly, almost 50% of working age people have arthritis.
Oh, 50%. Wow. That's a huge number. But now, is there a common issues that come up that an individual might say, well, I've been sore for, maybe a month. It's nothing, it'll go away. Is there common indicators of arthritis?
The one thing with arthritis is within your whole body. It can be anywhere in your body, any joint, or even connective tissues amongst your joints there. So, and what you typically see is just you could see pain or feel pain in that joint, or you might have inflammation in that particular area. So, if you're having any of those, definitely go check with your healthcare provider, and then they can help you with the next steps from there.
Yeah. Well, the generalized, I'm just thinking out loud here. Many times veterans seem to have arthritis. Are there certain, I'll say, careers or groups that tend to come up with arthritis?
Yeah, so like you said, veterans, surprisingly about 1 in 3 veterans have arthritis. Oh. And this is just, the hard jobs that they do. They're jumping in and out of vehicles, just the work you do.
Yes.
Other occupations, I shouldn't say occupations, but we see people in rural areas have higher rates of arthritis.
Interesting.
They haven't defined it, but they said that it's particularly probably because of the work. You're doing farming and ranching work, and so that's just really going to wear and tear on your poor joints over time.
Yeah. Well, I have a friend who works on bobcats, and he's kneeling on cement and ground all the time, and he had both his knees replaced. And I think that it's a joint that if you, I don't want to say abuse it, but you use it in ways that really weren't designed as us being human animals, it impairs that. Well, now we're quickly drawing to the close of our first segment, and we've got 2 more to go. What I find is really interesting is that over 25% of Montanans have arthritis, and that, we talked about what it is. It's an inflammation in the joints, and that there are some certain professions that might have it, but it also comes with age, but it doesn't necessarily tie in with age. Young people can have it too, which makes this a fascinating subject, which we'll discuss more in our next segment, so please stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about arthritis, particularly in Montana. Rejoining us is Melissa Dale, your program manager with DPHHS with the Montana Arthritis Program. And in the first segment, we were discussing about what arthritis is, but now that we've been declared that we have arthritis, what are some of the common first steps that one does when working with their physician to address arthritis?
Yeah. So unfortunately, there's no cure for arthritis. So there are steps that you can take to help manage your arthritis and your pain that you're going to, hopefully you're not dealing with, but if you do have pain, hopefully to help deal with it. So I'm going to talk about some of the things that you can do, but before I go too far, I'm just going to put a quick disclaimer out there that you definitely want to work with your healthcare provider to learn what the best remedies for you and how to manage your particular arthritis. Because everybody is so different.
And there's 100 different types.
Yeah, and there's 100 different types out there. So the first thing to do if you are diagnosed with arthritis is to research about the type of arthritis. As you mentioned, there's 100 different types of arthritis. So you want to research on the type of arthritis you have and to see what the best way to manage that particular arthritis. So a couple other things is to be physically active. And I know when you have had arthritis and you're probably thinking like, I have arthritis, my joints hurt, and I don't want to move. Like that sounds like the worst thing in the world. But it really is actually the best thing to do. One of the sayings we have in the arthritis world is motion is lotion. And rest is rest. So as you move, you're actually keeping your joints lubricated, and then as you're just sitting, you're just kind of resting up, basically.
Yes, I reflect that. Yes, in my life.
But yes, it's important to stay active. Like I said, it keeps you your joints lubricated. But another thing that as you're being active, you're continuing to either maintain or build your muscle strength, which is actually going to help keep your joints in place. Those muscles, really do a lot of work, and they're going to help keep that joint in there, and so they won't get wiggly or anything like that.
Interesting.
So and then when you are thinking about physical activity, we're not talking about doing jumping jacks. We want you to do something that's low impact, and that's something that you enjoy. So that could be walking, cycling, or doing water aerobics, something very just joint safe and gentle.
Oh, maybe go to the health club. Many health insurance plans for seniors include health clubs. So
exactly. Yeah, there you go. And they have a lot of places have great classes for seniors and stuff there.
Yes.
So I would encourage you to go.
Okay.
And you know, as you're working out, one thing to always keep in mind, there's a 2-hour pain rule. So, you know, before you work out, kind of figure out where your pain level is out of a scale of 1 to 10. And then about 2 hours after you work out, then see where you're at with that pain level again. If you are worse, that means you've either did too much or you were too strenuous or did something wrong. And so you want to modify the next time.
Right.
So
listen to your body.
Yeah, listen to your body. Exactly. Some other things that you can do to help manage your arthritis pain is to lose weight, especially if somebody who is overweight and obese. We tend to see people who are overweight and obese have higher rates of arthritis. And so if you're able to lose any weight, surprisingly, for 1 pound of weight you lose, you actually reduce 4 pounds of pressure off your joints. And those are those weight-bearing joints that we're talking about, like the hips, knees, and ankles. So, yeah, you definitely want to, if you can lose weight, that's a great idea.
Yeah.
Some other things you can do is some relaxation therapy.
That sounds fun.
Yeah, it's actually very nice. This is something easy as like meditating or yoga, doing some deep breathing, listening to music, writing in a journal, or even praying. Just something that just kind of brings you into a nice, relaxed state.
Yes.
Because as you relax, your muscles tension it decreases. Then your mind's off your pain.
Yes.
And then another thing that happens is you start releasing a hormone called endorphins, and those make you happy and stuff.
Yes.
So those are some great ways to help reduce your pain. But there's other things too. Another one is hot and cold treatments. So putting the hot pad on your joint wherever it hurts, or even a cold pad. If you're having inflammation, you can put hot and cold treatments and kind of alternate that and do some nice relaxation there. And then there's also medication. If you're going to take medication, whether it's over the counter or prescription, you want to talk with your healthcare provider. But that's another option if you, like I said, if you have to work with your healthcare provider on that.
I know when I had arthritis, I noticed that, I was taking aspirin, then I switched to Aleve, switched to something else, and each of the bottles said don't use for more than 7 or 15 days. And I thought, this is lasting too long. I better talk to my healthcare provider.
Yeah.
And but that's a bottom line. Talk to your healthcare provider if you have any idea or any pain or any questions, right?
Yeah. But you can definitely, like I mentioned, you can do some of these other techniques to help reduce the pain, but like you said, work with your healthcare provider. That's the number one thing to do.
To have an intelligent approach, medically approved, and for you to follow through. As I understand, a lot of people don't follow through with what their doctors say. You have to keep up with that. And I remember they said, you seniors need to get out and get some exercise like walking. And now that I'm a senior, before it was like, walking's exercise? Well, it is. Get out, get out in nature, go walking, and it does a lot for your body and it does a lot for your mind.
Exactly.
Doesn't it? So, and again, we're drawing to a close on this show, this segment, and we have one more to go. But what's really interesting is defining what we can do about arthritis. Over 100 different types. There are different approaches to address it. Relaxation is great. Getting a little bit of exercise. It can be mild exercise. Just start. It's the first step. You take that first step, and pretty soon you realize this isn't so bad, and I'm feeling really good. What's the next step? Got more information? Stay tuned for segment 3.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about arthritis. We have a program specialist with the Montana Arthritis Program, Melissa Dale. And Melissa, the state of Montana, you're an employee, and you're working towards addressing issues of arthritis in Montana. How does the state assume leadership or coordination in arthritis in serving our population?
Yeah, so the Montana Arthritis Program, we actually sponsor several programs, evidence-based programs for people to attend. A couple of them are exercise programs, and then we have a self-management class that people can attend to help address and manage their arthritis pain.
Yes, and to generalize, who are these offered through? But my first thought when you say that is maybe a local hospital does a lot of coordination on that, or?
Yes, we work with a lot of different community partners across the state. So as you mentioned, we're working with hospitals, we work with gyms, we also work with MSU extension agents. We work with anybody who in the community wants to put on these classes, and hopefully your community has one of these classes.
Right, or maybe they can be the initiative to get them going.
Yeah, exactly.
Well, Melissa, when you talk about classes, what are the classes? What kind of education programs do you have for people with arthritis?
So like I mentioned, two of them are exercise programs. Our first one's called the Arthritis Foundation exercise program. And this one is an 8-week class, and it's about an hour. You meet twice a week. And the great thing is you do joint safe movements. They're gentle. They're designed specifically for people who have arthritis. However, if you don't have arthritis and you want to join these classes, you're more than welcome to attend these classes too.
It's that exercise component to prevent it.
That's exactly. We want to get people in there. So yeah, that's our first exercise program that we have available. And then our second one is we have called the Walk with Ease. There's one thing we talked about earlier, just doing walking is a great exercise. And so the Walk with Ease program focuses on walking for people who have arthritis. And we have classes across the state for this one too. And for this class, what you do is you basically just go on a walk. You have a little quick educational lesson right before your walk. You go on a walk, and you do this for 6 weeks. You meet 3 times a week, or some classes I should say once or 1 to 3 times per week for about 30 to 60 minutes, depending on your particular class and your instructor and how long you guys want to go for. And this one also helps reduce arthritis pain and improves just overall health there. So
that's great. Now, how do we find out about these? We can contact you. There's a website.
Yeah, so we have a phone number. It is
on the screen.
Yeah, it's on the screen. Thank you. And then we also have a website, which is also should be on our screen. And the great thing about, if you go on our website, there is a beautiful map of Montana. You can click on your county. When you click on your county, then it'll pull up if you have a class, and then the instructor's information, and you can reach out to them and give them a call and find out when the classes are being offered in your area.
And it's so important to take that first step. I mean,
Yes.
just call them up, talk to them. They're welcoming. They want you there. You'd like to be there, and they're friendly, and it helps address the issue of arthritis. But now let's talk about the Arthritis Foundation that's in Montana. Tell us more about that and what they do.
Yeah, so what the Arthritis Foundation, they support us with all of these programs that we have. They're always providing education with communities and trying to give and helping the state of Montana also with just education, and we're just trying to get the word out there, and we're getting people trained up to offer one of these classes here.
Well, that's great. I know they're big advocates nationally for research, and they have different events that go on to support what they do. And they have a website. You can Google it, you can look it up and see more information there. But now, how about the Montana Living Well program that you guys offer?
Yeah, so this is our third class that we support here through the Montana Arthritis program. It's the Montana Living Life Well. And it's not specifically for people with arthritis. It's actually for anybody who has chronic health conditions, but they do address arthritis information in this class. But they also talk about, how do you manage your chronic health conditions? Because arthritis is a chronic health issue.
Yes.
They talk about how, relaxation therapies, which we talked about earlier. And so they go over just how to deal with living with a chronic health condition. And this is a fantastic class. People really enjoy being in this class. You get to talk with other people. It's very social. For this class, it meets 6 weeks, once a week, and it's just a great time for interaction. And so this one's more of an educational class versus the other one, they're exercises.
Well, in Montana, we're hitting the spring. The birds are coming back. It's nice. It smells wonderful. And so let's get out and walk. And you don't have to go far. Just start doing it. But now, what are some other classes that might be offered for individuals?
Yeah, so we are trying to work diligently, trying to get classes into all the communities and counties across Montana. Unfortunately, we just can't get into every single community. So if you don't have one of these arthritis classes, it's all right. You can go attend other exercise programs. So there's, yoga, Tai Chi, water aerobics, if you would like to do something like that. Those are fantastic classes to be part of. And just our biggest thing is just to move. Like we mentioned earlier, motion is lotion, and that's going to help you so much, not only just with your joints, but it's going to help you overall with your well-being.
And once you start being active, being active, it helps your body, but it helps your mind too, doesn't it? Yeah. It brings you around, and you start noticing things. And I think, during the COVID, we came down with some depressions, I believe, mild or maybe more. But getting out does that, plus meeting other people.
Yeah. And like you said, just walking, just even if it's just as little as 5 minutes, just getting out, just like saying hi to a person, is just really going to help overall.
Just take that first step and the rest follow. Well, Melissa, thank you so much for being on the show. We really appreciate your knowledge and your service to Montanans with and without arthritis, because it affects families too. Okay. And for our viewers, we've had some websites up. We've had an excellent discussion of what arthritis is, how it affects so many people, but it kind of comes down to get up, go walking, do a little bit of exercise, meet some other people. Spring is here. Enjoy it. Thank you for being here.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.